Sure thing.
Okay, we're good to go.
Right. Hello, everyone. Good evening, and welcome to the What I Did with My Degree presented by CUNY SPH Office of Career Services. My name is Jessica George. I am a current second-year student in the MPH track. I am an HPAM concentration, and I'm also the current president of the GSGA. I'm joined here today by my co-moderator for the evening, Taylor, who will be engaging with you all in the chat. Taylor, do you want to introduce yourself?
Sure. Thanks, Jessica. Hi, everyone. My name is Taylor Drost, and I am a CUNY SPH alumna from the class of 2022. And I received my MPH in community health with the specialization in maternal, child, reproductive, and sexual health. And I currently work for CUNY SPH in the Office of Career Services as the Career Skills Academy program manager. And if you're not familiar with the Career Skills Academy, it's a soft skills and professional development program that we offer to our master's and doctoral students. And I can put the link in the chat to the website if you want to learn more. But yeah, thank you. I'll turn it back over to you, Jessica.
Thank you, Taylor. So tonight we will hear from public health professionals who are CUNY SPH alumni and hold a Master's of Public Health degree in Health Policy and Management. They'll speak to us about their professional experiences and share valuable key tips and takeaways. But before we begin, I just wanted to give a brief description of the degree program itself. So the MPH in Health Policy and Management prepares students to plan and manage public health programs in a variety of urban settings, analyze the impact of health and non-health policies on population health, and advocate for policies that promote the health of populations. For more information on this degree program and others offered at CUNY SPH, you can visit the link that Taylor will share in the chat. So tonight's panel will include moderated questions for our panelists, as well as a Q&A segment where the panelists will get to hear from you all directly. As a reminder, you are able to visit other breakout rooms at any time. I do just ask that until we reach to the Q&A segment, please use the chat feature for any questions and comments. So now let's hear from our panelists. Good evening, panelists. I'm excited to speak with you all tonight. I look forward to hearing more about your experiences at as CUNY SPH alumni and public health professionals. So to get started, will each of you please introduce yourself to the audience, let us know your name, your degree program, graduating year, current title and employer, as well as a brief description of your current role. We'll start with Andrea.
Great. Hi, everyone. My name is Andrea Belfast. I graduated with a Master of Public Health in Health Policy and Management from CUNY SPH in 2024. I'm currently a Senior Study Coordinator working at Albert Einstein College of Medicine. In my current role, I support the planning, the coordination, the day-to-day operations of two research studies that are focused on opioid use. I work closely with investigators, project directors, and clinical teams to ensure that our studies are running smoothly, that we're following all of our protocols.
Locus G purple.
And in my role, I oversee participant visits. I collect and test biological specimens, conduct our interviews. I maintain secure and accurate study data. And I also assist with protocol development and recruitment strategies, as long as data quality reviews.
Thank you, Andrea. Everyone, please just make sure you are on mute and we can move on to Kristen.
Good evening, everyone. Thanks for having me here tonight. Excited to speak with you all. My name is Kristen Kolb. I graduated from the Health Policy and Management program with an MPH in January of 2024. I'm currently working at an organization called the Commonwealth Fund. The Commonwealth Fund is a nonprofit foundation that primarily gives grants that support health policy research, but we also have internal research efforts. So I work across a couple of teams, working on expanding health insurance coverage and access, and as well as the tracking health system performance programs. So my day-to-day work as a research associate is supporting the various research publications that the fund puts out in those areas, as well as working with some of our grantees who are conducting their own research, and making sure that the research publications our team is putting together are moving efficiently through the process, our internal process to get things published, as well as a little bit of publishing my own research in the form of blogs and short form things like that. So.
Wonderful, thank you. Next, we'll have Neville.
Hello and good evening, everyone. My name is Neville Green-Waterman. I was a part of the Health Policy and Management concentration here at CUNY SPH and graduated in spring of 2025. It's hard to believe that that was just 4 months ago. Um, I'm currently the Senior Program Manager of Market Intelligence and Business Operations at SIBA Health, which is a virtual chronic cure management and reversal company which delivers preventative health and longevity solutions through advanced technology and a high-touch clinical model. In my work, I sit at the intersection of public health, business strategy, and systems engineering. Um, in my role, I manage several projects that improve how different teams across the company, like our clinical, technical, and operations teams, work together. I also design systems as well as processes and data tools that help us to work smarter, faster, so that we can create a patient-centered solution as well as make patient-centered decisions. Um, Even though I'm not directly working with patients, my work is about population health and population health impact at scale, to be more specific. I apply systems thinking to identify where processes break in our healthcare delivery systems, as well as how to fix them. I use policy and management principles from my MPH training to align business goals with public health outcomes, like reducing chronic health, especially with cardiometabolic, which is one of our primary focuses. And I use a data-driven decision-making approach to measure how our programs perform and identify opportunities for innovation and equity. Thank you.
Thank you, Neville. And last but not least, we have Nikki.
Good evening, everyone. My name is Nikki Durand. I graduated with a MPH in HPAM in May of 2021, and I'm currently the Assistant Director of the Region 2 Public Health Training Center at Columbia University Mailman School of Public Health. Um, in all, we are one of 10 regional training spaces that's funded through HRSA, and we work to ensure a highly skilled public health workforce across New York, New Jersey, Puerto Rico, and the U.S. Virgin Islands. Currently, I help lead training programs and I coordinate with subject matter experts to facilitate our monthly Login to Learn webinars and help create self-paced modules that you can find for free on train.org. Lastly, I coordinate with our partners across all of our regions on our student field placement stipend program for graduate public health students completing field placements and internships in underserved areas.
Thank you
Thank you
all
for
for
having me.
sharing. Thank you all for sharing. You all have very different jobs that are all very interesting and intersects with public health. So now that we know a bit more about our panelists, we will proceed with the moderated questions. So to all our panelists, our first question is, why did you choose to pursue a graduate degree in health policy and management? Kristen, do you want to go first?
Sure. So I'm a registered nurse, so I am a career changer. I completed my nursing degree back in 2015, and I spent most of a decade as a bedside hospital nurse. Before I also, before I went to nursing school, I did have some experience as a working in research as a research coordinator, so that was already in my background before I went into healthcare. Um, so once I started working as a clinician over the years, working in our current healthcare environment, you see problems and you think about what can I do to try to fix those problems? So the combination of my interest in research along with wanting to have an impact at the more systems level, in addition to working at the individual patient level, interested me in public health. And I was interested in the HPAM track specifically because I saw policy as a potential way to try to have some type of influence on these system level problems. So that's what brought me to CUNY. The program was a great fit for me as a working student. And looking back now that I've made my career transition, I've just been very glad for all the opportunities I had here.
Thank you. I know that there are a lot of other career changers in this chat right now. So next, same question. Why did you choose to pursue a graduate degree in health policy and management? Nikki, do you want to answer?
Yes, definitely. I think for me, so I took about a 2-year gap from my undergrad and I worked out into the field doing odd jobs. I wasn't too sure if I wanted to continue doing public health. I did study public health in my undergrad studies, but I still didn't know enough about it. So, once I kind of learned a little bit more about health policy and really how policies affect long-term health, right? Obviously, we currently see policies now that are being taken away and or added that is contributing to our health now. I wanted to be part of that table and kind of start to prevent some health challenges that folks may have, right? So trying to think upstream, and I wanted to be more at the forefront. So being born and raised in New York, I needed a program that was affordable and flexible with my schedule. And then COVID happened, so I did it during COVID. Didn't get a chance to walk, but that's okay. And yeah, I'm very happy and proud about how far we have come, and and will continue helping those move forward.
Thank you for sharing, Nikki. Andrea?
Yeah, for me, I chose to pursue my degree in health policy and management, mainly because I just wanted to better understand and address the inequities that I was just seeing in healthcare. Um, I was working for a couple years in health insurance. I also had taken a little bit of a break before I decided to apply for grad school and, decide on public health as my degree. And I was just, starting to notice how people's experiences could just vary so much depending on where they lived, what language they spoke, or even just how the system was set up to support them. So for me, that just really opened my eyes, that, health outcomes are just not about the individual care. They're, shaped by the systems around us, how the programs are designed, how workflows are structured. And I just really wanted to be a part of improving those structures. And, just realizing and, that good care isn't just determined by where you go or who you see, but it's something that everyone should be able to count and rely on. And of course, my goal going into this degree was to help build healthcare systems that are more fair and efficient and more compassionate to the communities that we were serving. That's the kind of work, of course, I'm trying to do throughout my career. And I think definitely being in the HPAM track, that gave me the tools to do that, just connecting the data, the leadership, and just combining that with the strategy of still having that human side and connection. And I can also agree with what Kristen and Nikki had said. CUNY was really great while I was there for 2 years, just really flexible classes, allowing me to also work and still go to classes in the evening, and just having that support from our SPH family and all of our professors.
Thank you, Andrea. And Neville?
Thank you. So my background is actually in chemical engineering, and I worked in chemical sales and business development and traveled across the United States the entire time that I was pursuing my master's in public health. And to be honest, HPAM was not actually my first choice. My first choice was actually CHAS. I started a company called House of Ananda, and our focus is utilizing holistic modalities to teach communities how to manage stress. And so I decided to get my MPH because I really wanted to get into the community and better understand the structures and the systems that were in place and preventing stress from not being the focal point of our healthcare system. And throughout my first 2 or so semesters, I think it was really my first semester, I got a lay of the land and started to attend talks like this from different departments. And then I realized that HPAM is where I needed to be. It's where that I would get the managerial education, is where I would understand about the policies that affect the day to day. It also aligned with where I was in my career and where I wanted to go in my career. So that's why I switched from I think chess at the time to HPAM.
Thank you. I also switched from CHAS to HPAM. I think it's a common switch. And these are all wonderful reasons, and seems like everyone has a desire to enact system level change. So thank you all for your answers. My next question is to Kristen specifically. So, for registered nurses looking to transition from clinical roles into public health, what are some effective ways they can market their skills? Are there specific experiences or opportunities you'd recommend they pursue to make that shift?
Yeah, so I think it probably depends on what your goals are. For myself personally, I had an interest in research, so I focused a lot of my energy on developing that skill set, as well as trying to learn more about policy. So, in addition to, the skills I was learning at CUNY to support this career transition, I also had the opportunity to participate in a research fellowship at the hospital I was working at, which is where I was able to develop a lot of my research skills. So, and if you're if you're a student, you could work on a research project within CUNY. That's just how it worked out for me. But that's one area to focus on. The field work that I did through the degree, I was with administration for children's services through the city. So that was a great exposure to city government, learning more about policy. So the combination of those two experiences were really valuable for me in the transition from a clinical role to a non-clinical role. And I would also say that for anyone who's coming from a clinical background, you also want to think about your transferable skills. If you're working in healthcare in a patient-facing role, you're already a great communicator because you're talking to people all day. So it's just thinking about how you can use that in a different environment. And similarly, I work with data in a very different format now, but working clinically, you're also interpreting and absorbing data all the time that you're working with patients. So there are a lot of transferable skills, and that's also something you want to think about when you're looking for your next role.
Thank you, Kristen. That was really insightful. And to all the students, right now, feel free to drop in any questions in the chat during this segment, and we will be sure to get to them during our Q&A segment. Our next question is for Nikki. What is the most rewarding part of your job, and what gaps do you see in the current public health workforce, and how can emerging professionals help close them?
Okay, so the first part of your question, the most rewarding part of my job, I would say probably the student field placement um, experience. So we offer a $3,500 stipend to those completing a internship in the hopes to relieve some of the financial burden that I'm sure we have all experienced with taking an internship that is not paid. So that's mostly rewarding, and I love to see the projects that the students work on and seeing the experience that they gain. And then part two to your question, the gaps in the current public health workforce. I think it's clear, and it's obviously no brainer. I think the current climate we're in with all the grant cuts and the funds being pulled from public health agencies, universities, researchers across the country, I have noticed, and especially in our trainings, there is a dip in the public health workforce, and that led to a conservative hiring practice. Um, my advice for current or emerging public health professionals is to broaden your public health skills by doing tasks that may not be on your current job description. Do not limit yourself to only what is being asked for. So, public health, it's a very small field, and most of the teams are very short staffed. So, offer help wherever you can because in the end, that is a task that you can put on your resume. And learning those broad skills can be used to explore different opportunities that can get you to your next goal. So think about each role that you obtain, see that as a stepping stone to your next role or to where you want to end up.
Thank you. That's very helpful advice, very timely advice given the political climate right now. Our next question is for Andrea. How soon before or after graduating did you start your job search? How did you come across career possibilities related to your degree and skill set? And what strategies did you use for your job search?
Yeah, so for me, I had started actually job searching 6 months before completing my MPH. I just wanted to give myself enough time and just to like really understand what roles aligned best with the HPAM, being specifically in the HPAM concentration in public health, and also just using what my current experiences were in research and project coordination, and just finding a role that best fit to combine all of those factors. I think at first for me, I had focused on exploring a few different directions within public health. And this kind of just included some broad generalizations from research project management, healthcare operations, implementation roles. And then I just really spent a lot of time reviewing those job descriptions, looking at what qualifications the employers were looking for, what they valued the most, were there any common themes among all the job descriptions, and then kind of just identifying what my strong suits were. So, for example, whether that is stakeholder coordination, data management, process improvement, just trying to find roles that kind of highlighted some of those things that were more of my interest. I also think most of the opportunities that I came across were actually from networking and just having casual conversations with people that I've met either through CUNY, my professors, on LinkedIn, even talking to alumni and getting to know people on campus. I think that was really helpful for me to get insights and just to really understand and translating my academic and my research experience into practical skills that employers were looking for. And then when it came to actually applying for the jobs, I just tried to be, like I said, very intentional. Instead of just sending out a large number of like applications, I think it's really important to try to tailor each application for that specific job. Just, making sure your resume, your cover letter, everything is highlighting not just the impact, but also how do you think you're going to contribute to the broader goal. I think another thing is just also being flexible. Yes, we are in a public health degree more focused on health policy and management, but you shouldn't also overlook some of the roles that are also being posted. Kind of like what Nikki said, is just trying to expand on your skills aside of what you've learned from your MPH, because that'll also just really help you in the long run. Just in the case that some of these opportunities come up from you just having some of these additional skills. And so overall, I would just say start early, give yourself enough time. I know that job searching can be very stressful, especially right now in these times where we are seeing budget cuts and constraints to our field. I think networking, definitely put yourself out there and just being really strategic and staying open-minded. I think that's how I found a role that really aligned with both my training and what my long-term goals are in research.
Thank you, Andrea. And on the topic of networking, the Career Services has a lot of different events, so please do check them out. You get the opportunity to meet faculty, people, professionals, as well as fellow students. And you never know when you can get the opportunity. And so next we have a question for Neville. How does your background in chemical engineering and business strategy connect with the work you do now to improve healthcare delivery systems? And what skills have been most useful in your current role?
Thanks, Jessica. That's a great question. My background in chemical engineering really trained me to think in systems, to look at how all the parts of a process connect, find where they break down, and then to be able to design ways to make them work better. Later, when I switched into more of a business and sales focus and strategy focus role, I learned how to connect those systems to people and organizations and be able to manage teams as well as align very constrained and restrained resources and make data driven decisions. And I think those things, in terms of being able to problem solve, are skills that will take you to anywhere. Now that I'm in the healthcare sector, those two worlds for me have really collided, and I'm in my sweet spot. And before I say anything else about that, I was reminded recently about a CSA workshop on career values that I took back in 2022. And on that workshop by CSA, it asked us to sort of write out where we wanted to work, the environment that we wanted to work in, the people or supervisors that we would have, describe them in great detail. Um, and it was really astonishing when I went searching through my laptop and found this note that I took and realized that I'm working at a place that in 2022 was exactly where I wanted to work for the type of people that I wanted to work for in the environment that was, supportive of the complex life that I have being a caregiver for my dad and, also business owner and all these other things. So all that to say, CSA is amazing. It rocks. Know what matters to yourself and know what work you want to do and allow yourself to sort of find the right fit for you. Now to wrap up, now that I'm in the healthcare sector, I use my engineering mindset to analyze and improve complex delivery systems. And I use my strategist mindset to make sure that those improvements actually move the organization forward and patients forward. In everything that I do, I'm constantly thinking about how can we move our business forward as well as improve outcomes for patients. The most useful skills that I would say are systems thinking. I think we do offer a class on systems thinking, but if not, just ask some professors about systems thinking, process design, as well as being able to translate data into stories that people can act on. That is so important that we can tell stories and use data to tell those stories and support those stories that will help to drive people. And lastly, Kristen mentioned this before, focus on your transferable skills. You are really, really good at something that comes easily to you that others will employ you for. For me, it happened to be project management and problem solving, and those are skills that I know I can take to any industry and any sector. So, as I was in the chemical industry before and trying to transition, I had no idea how this thing was going to come together or where I would end up working. But I focused on those transferable skills and allowed and marketed it and did exactly what Nikki said and just talked to others about what my interests were. And this is how I landed at SIBA.
Thank you, Neville. It's really great to hear that you found your fit. And I know that's definitely good to hear for people that may feel lost right now. And also, what I'm hearing a lot is that public health is very broad, and as long as you know what you're good at, you can market those skills and basically find a place almost anywhere. So, thank you for that. We do have a couple more questions. So this question is CUNY SPH specific. So what student opportunities or resources did you take advantage of at CUNY SPH? For instance, student groups, volunteering, student employment opportunities, etc. Andrea, do you want to answer?
Yes. So I would definitely say Office of Career Services, Office of Experiential Learning, every week they send out a newsletter to all their students with updated opportunities. So I would say just keep up to date with checking your emails. I know sometimes there can be a lot and it can be overwhelming, but there are some really great opportunities that when I was a student, when I was doing field work, and again, also when I was just job searching in general, those are just two really great resources. I would also say just try to go to any of the events that are happening on campus. I think that's just a great way to connect with your peers. I think also as well, when I had started my MPH program, that was, we were kind of weaning a little bit off of the pandemic. And so we were kind of introducing socializing back on campus. So I think that was just a great way for us to kind of connect because at that time it was just really hard to kind of have that face-to-face interaction. Um, and I would say also just connecting with your professors. If there's an area of interest that you're really interested in or an area, see if anyone's doing any projects on it. A lot of the professors, at least that I've worked with, would love to have collaboration and your insight.
Thank you. And yes, the GSGA does host events every now and then. Please check your emails. You'll see a lot of opportunities there. Kristen, do you also want to answer this question?
Sure. I do remember participating in some stuff also through the Office of Career Services. I think I participated in the Career Skills Academy as well. So those are great resources. I thought the fieldwork program was amazing. It's such a valuable resource that CUNY helps you so much with finding your placement. I was really pleased with where I ended up doing my project, and that was a great experience for me. Um, I will say that in hindsight, I wish I had taken advantage of things a little bit more. I was started the program in 2020 and was also a healthcare worker during that time, so I had some other things going on, which sort of limited my ability to participate in some things at the school. But there are so many resources, and if you can take advantage of them, you should.
Thank you, Kristen. Could you actually speak a little bit more about what the Career Skills Academy is for those that may not know?
Yeah, it feels like it's a while ago, so I'm feeling a little fuzzy on the details, but I do remember it was sort of a great resource to help develop some of your kind of like softer skills, like interviewing and networking. So, and it was great to just be able to connect with other people who are also participating in that program.
Yeah, I'm the manager for the Career Skills Academy. So I have put the link in the chat to the website if you all want to learn more. But it's a really great program. It's a year-long program. So if you're interested, you apply in the summer. And if you're accepted, you enroll in the cohort for the full academic year. But yeah, definitely check out the website. And you can always email me if you want to learn more. I'll put my email in the chat too.
Thank you. So our next question is, what advice do you have for those with little to no professional experience as they begin their public health degree or consider going back to school? Nikki, could you start us off?
Yes. So, what advice do I have for those with little to no professional experience beginning in the field? I would say take any opportunity you can get because that opportunity will lead you to your next one, and there so on and so forth. Um, that's when I started the MPH program, I had little to no experience in public health. And it wasn't until my internship where I started to gain more experience, right? So even post graduation, ready to apply in the real world, I took a role that was all in all, it was um, like a student advisor role, had little to nothing to do with public health, but it got my foot in the door because other roles within that nonprofit was a health educator, a health navigator. So even though I started off doing something that was not in public health, there were other public health fields within that org. And then that actually led me to my role after that, which was a health and wellness navigator at a different nonprofit in New Jersey. So I moved, and so that really helped transfer that skills across state lines. And then now you have 2 to 3 years of experience in public health. So every year, just keep trying to see what else is out there that may not be your fit currently, and then just keep gaining experience to where you want to get to. My previous role, I was a mobile health clinic coordinator for the Essex County uh, Department of Health here in New Jersey, and it was as you can think, is a mobile health van, right? So we went around to parks and most of our programs. I helped manage the vaccine for children's program, and believe it or not, I actually because of the grant funds, that was a role that got cut. So, but I took those skills to where I am now because for so many years I just took roles that helped me get to where I wanted to be. So be patient, have a little bit of faith, and you will definitely get to where you want to go. Was there a part two to that question?
No, there wasn't.
Okay.
Thank you, Nikki.
hmm
Neville, do you have some insights you want to share?
Absolutely. And this was for a professional experience.
Yes.
I would say there is a book that I read in this transition when I was very lost. It's called Strength Finders. And it's by Gallup, and I think the author is Tom. Give me one second. I'll get it for you. Tom Rath is the author. It's called Strength Finders 2.0. And this book, and there's an assessment in this book. It really gives you, it helps you with the language to be able to put behind the things that you're good at. And taking this assessment helped me to understand what I was good at and how those things can be integral to an industry that I had very little knowledge about. So I first understood how do I fit into the MPH landscape and public health landscape. And then I talked to everyone that I could. I spoke to advisors about what my interests were and what my strengths were. I spoke to professors, and every class I learned something new and I told them about my interests, and I allowed my interests to evolve over my career at MPH at SPH, sorry. And I think that really allowed me to not only to change and really find myself, but it allowed others to help me. You cannot ask a stupid question. If you don't know, ask somebody. Reach out and say, I'm interested in this, but I'm not sure how to get there. And you don't know who your professors know or who CSA staff know, and so they might just reach out. Also, I would definitely say go to CUNY SPH on LinkedIn and start to look at the alumni that are part of the connection. See who there has a career path that interests you, and start to reach out and ask questions. I think that's one way that you can definitely start to build some skills. And again, use the skills that you have. Even skills that you may have outside of the public health sphere, even if it's being a cashier, or working in retail. Those are all skills, money management, due diligence, and you can really tell a story based on those skills. And nothing that you have gained to this point is too small towards your bigger goals.
Thank you. That was excellent advice. My next question is, how do you continue to grow as a professional within your current role? Kristen, do you want to answer?
Yeah, absolutely. So there is support for professional development at my organization. So there are funds available like for training courses. I took one last summer to learn the program's data, which a lot of people are using for data analysis. That's the area that I've kind of been focusing on where I'm trying to grow my skills more, just learning more about coding and being more efficient with data analysis. And on top of that, I mean, a lot of it is just trying to keep up with, which is not easy these days, keeping up with policy developments and just understanding the state of things and the latest changes, learning as much as you can about those topics as things evolve. And yeah.
Thank you, Kristen. Nikki, how about you?
Can you repeat the question, please?
Of course. So, how do you continue to grow as a professional within your current role?
Great. Take advantage of your current um, department, the current staff that you have, friends at your job or role. Tap into them, see what they've been up to, see what past roles they may have had, or networking events that they have gone to. Go together. Definitely look on LinkedIn. I feel like LinkedIn has a lot of um, free trainings to take, networking advice and whatnot. Um, and then I can't stress this enough. Please do not stick to your current job description. That I have come across a lot of people that have specified that in previous roles they have only stayed in their lane. Um, I think there's a boundary to that, right? Like I think there's hierarchy and there's certain channels that you may have to go through, but in terms of being a team player, if it's not on your task or your main job description, um, ask to learn more and help out more. Um, I advise against saying that's not in my job title. It will only prevent you from having more opportunities. So definitely allow yourself to learn more and take up space.
Thank you so much. So basically, the name of the game is don't limit yourself and network.
Yes, that's the polite way to say it.
Perfect. Thank you so much. The next question is, what is most rewarding about your job? Andrea, could you answer?
Yeah, great question. So I think one aspect of my job that I love the most is just kind of seeing how my contributions touch the patients that I work with. I am in the clinic 5 days a week where I am one-on-one with the patients that are enrolled in our research study. And it's just really delightful to see how my role in the study can make their experience less stressful and more positive, especially with the community that I work with. There's not a ton of support. A lot of times, the individuals that I'm seeing are in clinics where there is mental health issues, substance abuse issues. So for me, it's just really positive to see, especially how I've develop this relationship with a patient throughout the 9 months that I see them and where they've started and how I've basically helped them at the end and how I see them in the clinic after they're done with their study. I also think from a data perspective, I'm also very much involved in analyzing our data, and we've started writing some papers and presenting at conferences and submitting abstracts. That's also been really cool to see. I've started at the beginning on some of these projects, and a lot of them are kind of coming to an end now. So it's just really nice to see the overall picture of what some of these data points were and what it's telling us. Yeah.
Thank you, Andrea. Everyone, please continue to put in the chat any questions you have because we will be asking our panelists those questions in a few. And Neville, do you want to end with this section on what is most rewarding? What is the most rewarding part of your job?
Absolutely. My job is fully remote, and the most rewarding part of my job is the balance that has given me to be able to manage family life as well as work life. And I didn't realize how much I needed it until I had this opportunity. Um, and so it really allows me to take my laptop and work from my god kids, and I can see them and really still contribute to my job. Whereas I'm also able to be with family that are far, far away from where I am. And so that re enrichment of my personal life, along with my passion for what I do at work, it really keeps me fired up. And it helps me to not be burnt out, which was something that was a chronic experience of mine in my former roles. And so really I focused on finding a job that allowed me to balance my life the way that I wanted to. And so it really has been rewarding on a personal level, and we're all people first. So I really wanted to really uh bring it to the forefront. I love the impact that I have on chronic health reversal. I love the impact that I have on improving my teams and things like that. But honestly, I love how my job allows me to be a human first. And that's what's most rewarding.
Thank you. That's great advice, especially for a group of students. I know a lot of us work full time, maybe even have family duties, so it's important to realize that we're a lot more than just our degree or just our job. Thank you for that. So now let us hear from you all, the audience. Taylor will read some of your questions from the chat. You can also use the raise hand feature to ask your questions out loud. So Taylor, would you like to start us off?
Sure. So in the chat, we have a question that was directed to all panelists. And Kitty asked, do you feel there is anything in addition to the training at CUNY SPH that we should learn to prepare us for real world work?
Would anyone want to answer that first?
I can start off. I would say personally, in my current role just specifically, although again, it was not in my job description, but again, broadening your skills, I would say try to learn some coding programs, whether that's SAS or R. Try to look at the job descriptions. I know every organization kind of has their own preference of what system they like to analyze their data with, but I think that would definitely give you a leg up of just having that extra skill under your belt. Because like I said, you could be working on a project and there's going to be a time where someone has to analyze this data. And again, that will open up really good opportunities for you to, if you're interested in writing papers, if you want to travel to do conferences and submit abstracts. I think that's one thing I would take advantage of aside from just your courses at CUNY. There's a lot of great free resources online that you can take some coding boot camps. So I would definitely say try to get a little bit more analytical skills under your belt as an HPAM student.
I can go next. I think from me is to also learn the basic use of Excel. Excel can go a long way. I feel like a lot of organizations that are grant funded, right, can't afford the yearly subscription to SAS or our strata. So definitely trying to use Excel. There's a lot you can learn with it. You can also take trainings with us. And I would also recommend starting to get comfortable with, and there's a question in the chat for it as well, with AI. I feel like we all think that AI is being kind of tossed at us and down our throat, and it can be kind of frustrating. But see it as a tool to the knowledge you already know. Do not give up the education that you have learned and submit yourself to AI, because if you submit something that is not in your own words, it reads like that. It reads very robotic. So for example, like Chat GPT, if you're using chat, let it prompt you to where, let's say, if it's a professional email that you just want another set of eyes on, right? So using that to guide you with it, but let it just be used as a guide. Do not submit yourself to it. You have come too far with a master's degree. At the end of the day, critical thinking will definitely come across farther. But slowly starting to get into AI, no rush, but start with chat and just kind of see where it could help enhance your skills. And I will leave it like that.
I would add the learn about innovation mindset. An innovation mindset is a way of thinking, creativity, problem solving, and it uses different techniques that can be utilized in startup development work as well as regular corporate work. I would also say be adaptable. I think Nikki really hit it on the head with sort of honing those skills from Excel because you might need to use a different tool than what you're accustomed to. In my former, career, we used Microsoft Word for everything. In my startup that I work for now, we use Google Suite for everything. And so I've had to become very creative and learn on the job in real time how to adjust my tools and skill sets from one platform to the next. So being able to work across various tools is something that is very helpful when employers love to see that. And again, I echo what Nikki also just said about AI. There's a big fear that AI will take jobs away. I think that AI will take jobs away from individuals who don't know how to utilize AI. And utilize it as a tool, not to do the thinking for you. As Nikki just said, it is a great tool when you know how to use it well. I use it a lot for market intelligence, and in this landscape where things are changing moment by moment in the same day, it helps me to gather information and then synthesize it. but I'm not using it to think for me. So again, those are some tools and skills I think you should learn in addition to any of the CSA programs.
I completely agree with what everyone had said, commenting on coding and Excel. And again, yeah, learning how to incorporate AI as a tool to support you. And I would also add, we're talking about these different technologies, but also communication skills, a little more old-fashioned, just, both your written communication and your verbal communication, being able to, present something in a meeting, how you give a presentation, being able to speak with people who are at different levels in organizations, being able to build relationships with your peers and coworkers. So in addition to all the technological solutions, I think a little bit of that old-fashioned skill set is still necessary as well.
I want to add something else. I work with a lot of interns, and the thing that stands out to me about an intern that I would recommend to my boss to hire is someone who takes initiative. And it really comes down to those soft skills that Kristen just mentioned. Someone who would ask proactively, how can they help? Someone who is not afraid to ask a question when they are confused. I don't mind spending more time explaining and making sure that you get a great experience when you come to SIVA and you're trying to get your field work done or what have you. But if you are just, a wallflower and I can work with you, but that person who's proactive really makes my job a little bit easier, so then I can pour a little bit more into you as well. So, and that really does come down to those soft skills. And sometimes it takes a little bit of being uncomfortable to find the comfort in that role.
Thank you. That's great advice. Can move on to the next question. If anyone has any questions, don't be afraid to raise your hand and just come off mute and ask. Otherwise, we will be reading the chat for any additional questions.
I can read the next question in the chat for now. Lauren asked, how, if at all, have you experienced the challenges facing public health in today's socio-political and funding environment, and what skills or training have helped you stay resilient? Is there anyone who wants to take a crack at this question?
I can start off. So we are grant funded through HRSA. If you know HRSA, it falls under HHS, which, as we know, it's been a interesting time to say the least. So the challenges that we have faced is that um, now, right, there's uncharted waters where grant funds can be ripped right under you, even if you're in a mid-year grant year, even if those funds were 100% appropriated to you for, let's say, you're in a 4-year grant period and you're on year 3, and now they're taking that away. So the challenge is, especially when working on a grant, right, is making sure that the funds may not be there. So that is a con. But I think a positivity about working on a grant is that you are managing that grant. So in terms of uh, reporting, del deliverables, grant management skills, funding skills. You learn a lot being on a grant, but there's also that fear that currently, it wasn't always like this, that the funds may not be there or it may come late. Um, so I think side note, just ready for the next 3 years to be over.
Would anyone else like to answer that question?
I can also add on to similar to what Nikki said. The one of the research studies I am currently on is an NIH grant funded study. So of course, we all know there have been some major cuts, not just to the studies, but of course to the institution that I work for as well. So of course there was just a lot of uncertainty at the beginning of the year, where grants were, of course, just being cut without notice, and where there are a lot of restrictions now on what is included in your grant proposals and your grant budgeting. But I can say that I think one thing that we're just trying to focus on now is, again, just the patients that we are here to serve and just keeping them and, trying the best that we can and showing up every day to the best of our abilities. And I know as an institution, for example, just trying to work with our stakeholder networks and just trying to collaborate across departments and just trying to really strengthen each other. Just again, like Nikki had mentioned, in case one of our funding streams do unfortunately get cut, trying to manage and balance amongst the grants that we do have.
Thank you, Andrea and Nikki. Neville, did you have something to add?
Yeah, I want to offer a perspective from an operations stance. This is a really difficult funding time, regardless of if you are getting funding from the government. Money is not being invested the way that it was in 2020 or 2021 in public health across the board. And teams are running really, really lean. When I say that, I mean that you're not hiring 3 and 4 people for a team. Now there's maybe 1 or 2 people doing the work that 4 or 5 people may have done. And so, again, broadening your skill set to be able to do more than what a particular job role may ask is really, really important right now. Because as grants are getting cut, as you are seeing roles being trimmed, you may be asked to do another role that you didn't intend to do, or you didn't, that wasn't given to you when you became a part of the organization. And who are they going to keep? The person who is willing to learn on the job, who has varied skill sets, and who can be a Swiss Army knife. And so I think in today's day and age, it's not enough to just be a specialist and to have one focus area, but be able to take those skills, whether they're, hard skills of coding and data analysis and all these other things, or what have you, but be able to take whatever you have and spread it across the board to other things as well.
Thank you, everyone, for your answers. We have another interesting question from Jake. I was wondering what you all might think the field of public health might look like in 5 years.
Jake, I think it will look very promising. I think we would be in a rebuilding phase. Um, Definitely rebuilding. I think, I do think though, it will be hard to recuperate all the funds that were once appropriated for a lot of our grant projects. Um, USAID, global health, especially that can take a very long time to rebuild. But I think it will, I'm hopeful. I'm very hopeful about it, and I think it will rebuild. It's just going to take a lot of time to rebuild, right? I say it's easy to knock down a house, but it's hard to build it back up.
I would say 5 years out, I think that the role that technology plays is going to be even more present and important. I think about life before COVID and life right after COVID and how we are on Zoom calls. And back in the day, just 6 years ago, these were things that were mandatory in-person meetings. And so whenever you see a constraint or some sort of shakeup, it challenges innovation. It challenges us to think outside the box. And technology is going to have to evolve with the constraints, the resource constraints, financial and otherwise, that's being put on public health. And so keep your eyes on and be attuned to evolving technologies, whether it's AI or the next thing to come, as well as platforms. Know how to use whatever digital platform is emerging at the time, and you'll be prepared for whatever 5 years brings.
right, Taylor, would you like to read the next question?
Sure, I might jump around a little in the chat and I'm going to paraphrase what Bryant asked. But so, do you believe that the concentration that you have during your MPH degree limits you to the specific jobs, or in the real world, does everything seem to overlap, in your opinion, if anyone would like to answer?
I think the bigger factor is your skill set over the concentration itself. I don't know if it's so much that an employer would look at what your concentration was and say, oh, that's not the right concentration for this role. I think it's all about what skills you developed, from, whether it's something you took as an elective class or something that wasn't part of your concentration, however you came to that skill set. I think that's what's going to be more important than the concentration itself.
I agree. I think having a HPAM background from my experience, I've worked in community health. I was a health educator for a long time. I have a CHES background. I got a CHES because of it, but it was just based off the skill sets and what I was able to use and just grow.
I would also suggest in your earlier classes to make friends with people that are not in your concentration. You have no idea where they will end up and where life will take you. So make friends with them and stay in touch. I have CHAS friends from my last class because I took a CHAS concentration. And so, I've been able to network still without in my department, but even outside of my department. So just make everyone your friend.
All right, thank you. We have another great question from Tyler. Are there any certifications or licenses you acquire to help you land your role or help propel your career?
Sorry, I keep jumping on. Please tell me to stop. Yes. So, after I graduated in 2021, and for a whole year, I studied for the CHES exam. That is a certified health education specialist, and that you have to renew every 5 years. You have 5 years to get up to, I believe, about 80 CEUs. That put me in a better space in terms of how to market myself, right? Broadening my skills. I did not come from a health education concentration. It was health policy, and I paired it with health education. So yes, definitely, I would say CHES. And there's also the public health credits, CPH. I would say Ches weighs a little more heavier than CPH, but you're welcome to obtain that as well. And it did help my career. Sorry, the last part of your question.
Would anyone else like to answer that question?
For me, a project management professional certification is something that has helped me along my career. There are tons of certifications that will help you hone skills and give you access to resources and networks. And I think it all depends on what you're interested in. And so when you find that niche thing that you really enjoy doing, whether it's health navigation, whether it's health coaches, um, whether you want to become a registered dietitian and things like that. There's several other certifications along the way that can help. I just got certified to do um, as a part of my application for SIBA for the American Diabetes Association ARP program. Now I'm certified in diabetes education. And that just happened to be, something that I gained along the way in the last couple of months or so. So find your interest, find your niche, find for it.
Thank you. Taylor, do you want to read the next question?
Sure. Michelle asked, how did your fieldwork and capstone experiences build skills that may be relevant to you today?
So I'm gonna jump on here because my field work transformed my life. I went into my field work. At the time, I was still working in the chemical industry. I was like in Minnesota every other week. And there was no way conceivable that I would have been able to do my capstone and work full time in the chemical industry. And so I saw the CEO for SIBA. He spoke on a CSA career panel similar to this. I got to know him and I stayed in touch. And that was 2 years before I even did my field work. And when the time came for me to do my field work, I wrote a proposal and sent it to him, and he said that's great. And then he sent me their business needs, and we came together. And that was the first year that SIBA had ever been a part of the list of uh, list of like approved places to do your field work. And that was because I sought them out, and I, requested that I would be able to work with them because they aligned with my career values and where I wanted to go. And from the time I got to SIBA, I was very adamant that I wanted to be hired full time and that I didn't want to wait until I was done with my MPH because I wanted to do my capstone on the work that I was doing there at SIBA. And by the time I was completed with my field work, they agreed and I agreed that we were both good fits for each other. And I was hired in November 1st of last year. And so I left my old job in the middle of, my fall semester for my second to last semester, right after my field work, which I completed in summertime. And so your field work can really transform your life. It can really, you know, be whatever you want it to be. And so, don't wait to the last minute, in May or maybe even June to start looking for your field work. If you are really changing careers, really give it some thought and find out where you want to see yourself and really position yourself to be there.
Does anyone else want to answer that question?
Yeah, I had a great experience with my field work. I was just thinking back to my project that I worked on, which was my first exposure to learning about a lot of federal health policy topics. I did a project related to different types of insurance models within Medicaid and just being able to deep dive into that topic with the support of my fieldwork mentor was something that has really helped position me for the kind of work I'm doing now. So I was very lucky to find something that just like aligned so well with my interests, and it sort of gave me the confidence to keep digging into that type of that topic area. And it was also good to develop the skill set of just reading like policy and regulations, which was something that I had a little exposure to in my classes, but not as much as I got through my fieldwork. So on the whole, the fieldwork was one of the most impactful experiences of my time at SPH.
Thank you, Kristen, and thank you to all our panelists. For the sake of time, we are going to move on from the Q&A portion. So we are coming to the end of our program, and I did want to thank all our panelists for being here with us tonight. To close us out, each panelist will give us their final thoughts. So Nikki, do you want to start off?
Yes. Sorry, I was commenting back to another student. Rephrase your question again.
Just your final thoughts.
Oh, final thoughts. I wish I joined a lot of things like this. I wish I got involved more with CUNY SPH. Obviously, because of COVID, I only had the fall of 2019 really to kind of be involved. Um, but I actually got involved post graduation. I stayed involved with my advisor. She kind of helped me reframe my resume and changed it up a little bit. So I'm still in contact with her. But my final thoughts, I would say, is to just keep pushing. Definitely be stay patient, right? And you're in this field not for the money, but you're in it because you want to help others. And I think just keeping true to that will help you get farther. Thank you for having me.
Of course. Kristen, do you want to just say your final thoughts?
Yeah, it's certainly a challenging time for anyone who's interested in public health and the future of public health. But I just hope people and all of us can try to just remain a little bit hopeful or optimistic, and hopefully down the road we can try to turn things back around and get into a better place. So I just encourage people not to give up what brought you to this field in the first place. And just reiterating what we already talked about in this presentation, while you're a student, really focus on developing your skills. And I just want to thank everyone for joining tonight, and I had a great time participating in this panel.
Thank you. Andrea?
Yeah, I think just as a closing remark, I think whether you're, looking for your next role, whether you're still in grad school, figuring it out, just remember that there is a really big public health community behind you, supporting you, rooting for you. Like Nikki said, just take it day by day, just put one foot forward, of course, right now, the current climate of public health, let's just be really optimistic that things are going to change in the next couple of years. It's a challenge, but just remembering and grounding yourself in why you went into this field and the difference that you're going to make and the impact that you're going to have on communities. I also think as well, take advantage of the events and networking on campus and with alumni, other students. Of course, anyone that's in this or that's on the panel here, I'm sure any of us would be more than happy to, if you were to reach out, if you had any additional questions or advice, we would definitely respond back to you. But I think just also remember, it's a balance. Take care of yourself through this process. It could be very overwhelming. And I think, like I said, just keep connecting, take opportunities that are going to allow you to learn and grow, and just broaden your skills. And of course, don't forget, enjoy your time at CUNY SPH. I feel like sometimes you get really, deep and down into it of just focusing on, I just need to finish this degree and, doing all these things that just check the boxes of. I think just try to enjoy it. You're going to meet some really great people in your programs. Again, like I said, connecting with professors that are going to become lifelong friends if you collaborate with them. And yeah, thank you so much for having me. It was really great connecting with the other panelists and also, trying to give some advice to current public health students. So thank you.
Thank you, Andrea. And Neville?
There's a quote that says, if you want to go fast, go alone. If you want to go far, go together. And what we need right now, more than anything else, is community. Um, Reach out to your community. Please take care of your mental health. Take advantage of all of the resources and counseling and community that is offered at CUNY SPH. Reach out for help when you need it. Let your professors know if you are, experiencing any challenging times. These are very difficult and unprecedented times. And so know that you do not have to do this alone. Lean in on community and you will get there. Continue to build your network amongst your student cohort and then continue to lean out to alumni and professors and everyone else too professionally. But I think my final thoughts is focus on community, and you will all get where you need to be.
Thank you, Neville. So on behalf of CUNY SPH and the Office of Career Services, we just want to thank everyone for coming out tonight. We hope that the panel was insightful and encouraging, and we also look forward to having you join us for day 2 of the panel series tomorrow. Please visit the Career Services website to learn more about the resources available at CUNY SPH. And staff will be in the main Zoom room for a few minutes if you have any additional questions. You will also receive a post-event email Friday with the panel recording, as well as contact info sheets, so you can directly connect with our panelists. Don't forget to complete the brief feedback survey that will pop up once you leave the meeting. Good night, everyone. Thank you for coming out.
Thank you, everyone.